So the Affordable Care Act actually requires exchanges to provide quality ratings, and that's a few years down the line in the future, starting in 2016. Cover Oregon and a few other state-based exchanges, a handful, have decided to go ahead and try to provide meaningful quality measures now. Cover Oregon has a rating that's associated with each plan that's on the exchange of 1 to 4 stars. And those ratings are up now during open enrollment for carriers that are offering plans for the 2014 calendar year. And those star ratings are based on 12 quality measures. So if you doze off after this slide, that's totally cool. This is the key slide. This is the important one. So the ratings are 1 to 4 stars. And what they're really telling us is how carriers compare on each of those 12 quality measures that they're based on. How the carriers compare to 3 benchmarks on each quality measure. So the benchmarks are the Oregon average for that quality measure, the national average for the quality measure, and the national 90th percentile for the quality measure, the top 10%. So 1 to 4 stars, and those are up on the website. And the way they work is if a carrier exceeds all 3 benchmarks, they get 4 stars. If they exceed 2 benchmarks, they get 3 stars. If they exceed one benchmark, they get 2 stars. And if they exceed none of the benchmarks, but they still qualify to be on the exchange, they get 1 star. And plans have to do, even setting the stars aside in the ratings, plans have to do a lot to get on the exchange already. They have to meet the standards of the Oregon Insurance Division. Then on top of that, they have to meet other standards that Cover Oregon sets for them. So they've got to do a lot already. And these ratings are just about how many of these benchmarks they exceed. So these are the 12 quality measures that the ratings are based on. And they fall into 3 areas: preventative care, complex care, and patient experience. These quality measures are almost all percentages. So, for example, the percentage of people, the carrier's population who gets the recommended breast cancer screenings, the percentage of the relevant population who gets the recommended diabetes screenings, the percentage of people who were surveyed from a carrier's population who rated their health care an 8, 9, or 10 on a 10-point scale. I think the only exception is the avoidable hospital admissions measure, which is avoidable admissions per 100,000 people in the carrier's population. All of these measures have been developed by nationally recognized expert agencies and vetted and validated. So almost all of them come from NCQA, which is the national, oh my gosh, quality assurance. Okay, it's an expert. It's good. It's all good. And that's a national organization that develops measures so that employers can evaluate health plans, so that health plans themselves can know how well they're doing. So almost all of these are from their HEDIS, Health Effectiveness Information Data Set. I think I got that one. And then the only exception is, again, the avoidable hospital admissions, which is developed by the Agency for Healthcare Research and Quality, which is part of the Department of Human Services, and that's from their PQI set of measures. So, and most of these are calculated from claims. The ones that are not calculated from claims are the patient experience measures and the flu shots measure. Those come from the CAPS survey. And I believe those are all HEDIS measures. So these are well recognized and well validated and nationally recognized measures. Cover Oregon worked with Oregon's Healthcare Quality Corporation, otherwise known as Q Corp, to select the measures and create the ratings. Q Corp, they are the experts. They are nationally recognized by Health and Human Services as a data center. And they also work with the Oregon Health Authority to develop and validate quality measures for Medicaid community coordinated care organizations. So we really hired the experts to work with us and choose the measures and create the scores. Q Corp helped us narrow down the initial set of measures we wanted to use, because there are literally thousands and thousands of plan measures you can choose from. And then Cover Oregon and Q Corp took feedback from consumers and carriers and other stakeholders to get down to the final set. So this is where you can start to fall off if you want, because it's the details. But I'd like to walk through the steps to actually compute these ratings. Some of the more quantitative policy people might like this, so we'll see a show of hands. So there are 4 steps to creating the overall rating, the 4-star rating that you see when you go on our website. The first is that Q Corp calculated each measure, the score for each measure, separately for each line of business that the carrier had in 2012. So keep in mind that the plans that are offered on the exchange, they don't have any membership yet. They're not going to have any membership until the 2014 calendar year, which is the first year people are going to be enrolled in them. So to calculate these ratings, we had to look back to the most recent year of data available, which was 2012. And we made the decision, okay, what populations do we score on? We will score on whatever populations the carrier had in 2012. So those could be Medicare, Medicaid, or commercial. And different carriers had different populations, the carriers that are on the exchange now. Some had all 3 of those populations. I think a few had only Medicaid and Medicare. There was one that had only Medicare at the time. And there were 3 carriers that actually didn't have populations because they're new. So that's another issue offline. But very different carriers, so we had to figure out how to score them, and made the decision to use their entire population for the year. Step 2 is after Q Corp computed those quantitative scores for each population, they benchmarked them according to the 3 benchmarks to get a number of stars. So now each measure has got however many stars there are for, if the carrier had the 3 populations, it's got 3 stars. The next step was to weight and sum those so we get a star score, a single star score for each measure. And then the final step to get the composite score that you see on the website was to average those all together. I will maybe actually skip through. We can go back to this if there are any questions about sort of the mechanics of it. But this is what the stars look like on the website. And if you go on the website, you can actually click on the stars and a user-friendly, consumer-friendly explanation of what they mean will pop up. Not unlike what you've received tonight. So there are ways that the measures we use and the methodology that we employ to roll them up might change in the future, to the extent that the federal government actually comes out with regulations about how exchanges have to do quality ratings. They might tell us what we have to do, or they might provide states some flexibility and say, okay, you can go your own way in your quality ratings. In the nearer future, there is a work group that the legislature in its last session has required Cover Oregon to facilitate, and required Cover Oregon and the Oregon Health Authority and the Public Employees Benefit Board and the Oregon Educators Benefit Board all to participate in, where all those different organizations are coming up with a core set of quality measures that all of them will use together. So we might come up with some different quality measures from that work group and that discussion, and that might inform the measures we select for not the next year, but the rating year after that. And then in the future, there are some different ways that we could go with quality measures to help consumers. One possibility, and there's a site or an organization called Consumers Checkbook that I think does some of this now, is that you can, or could, if we can get the technology together, you could choose from a bunch of different quality ratings based on what you're interested in. Let's say maybe I have a chronic condition. I don't really care about child visits or preventative care so much, but I want to pick all the measures that are measures of caring for a chronic condition. So I pick those and I build my own composite quality score. And you can contact me with your questions and your ire about the exchange. My information is up there. Thank you.